what is a real phenomena, or why he perceives pain? Is it because of his depression, or he wants to draw the attention, or what is your take on this?
Yeah. Okay. So if we talk about the different, you talked about, whether there was tissue damage or not. Let's talk about the different types of pain. So we have what we call as nociceptive pain, which is pain through damage to or stimulus to the receptors in the periphery. The second group of pain is called neuropathic pain, and that neuropathic pain is when there is damage to the sensory system. So either there is a compression of a nerve, or there has been neuropathy due to illnesses such as diabetes, etc. And the other kind of pain is what we call as possibly nociplastic, where there is a lot of what we call central sensitization. So where a normal painful stimuli would elicit a certain amount of pain, in somebody who's sensitized, that threshold has changed, and for them they perceive it as much more. And this is dependent on how much sensitization has occurred in the brain to pain. Talking about how your mental health status affects pain, there are numerous neuronal circuitries in the brain which all act through different pathways. Now we know that distraction helps with pain. If you distract somebody, they don't see pain, as they don't perceive it as much. In a simple, for instance, we use something called as a TENS machine, which is transcutaneous electrical stimulation. What that does is, normally pain travels through A delta and C fibers. This one stimulates the A beta fibers. Because of that, that changes the modulation at the spinal level. So those pain impulses are not going to the brain.
I see.
So there is a modulation. Now with regards to whether you're depressed or happy, it appears that those are dependent on the amount of neurotransmitters in the brain. So the amount of dopamine, the amount of serotonin, the amount of norepinephrine. And if your levels of these vary, then the pain that you perceive, it changes.